The number of new COVID-19 cases reported in the United States on Friday was the highest since the depths of the winter surge in the month of January, with hospitalizations and deaths also on an exponential rise. There were around 194,000 new COVID cases reported, according to the Johns Hopkins University, bringing the 7-day rolling average for new cases above a lakh, the highest it's been since the 7th of February. Meanwhile, more than 48,000 people are now hospitalized, according to the U.S. Department of Health and Human Services, which remains well below the more than 130,000 who were hospitalized during January's record peak. U.S. President Joe Biden said, and I quote, "In all probability, new guidelines or restrictions would be imposed in the U.S. in a response to a resurgence of COVID-19 cases in the country." So what has actually happened in America? Did they open too soon? Did they actually feel that future variants will not mutate and strike even those who have been fully vaccinated? That is problem number one. Problem number two has been the maximum number of people who are against getting vaccinated are to be found in America. Vaccine hesitancy is something which has become extremely problematic for the American government. In fact, there were freebies. Money was even being given to people for getting the vaccination, just to give you a mindset of the people who are afraid of the vaccine. We'll talk about this. What does this mean for India? Just a couple of days back, Air India also upped the ante and increased, or rather doubled, the number of flights from the United States and to United States. Is that something which has been done too soon? Padam Shri, Professor Dr. Mohsin Wali, cardiologist and physician, joins us on the program. Dr. Narendra Saini, Chairman, Indian Scientific Committee, Indian Medical Council, also joins us on the program. Dr. Swati Maheshwari, internal medicine specialist, former senior consultant. Fortis Hospital is also here with us. And last but by no means the least, Dr. Shruti Malik, director of Radix Hospital, is also joining us on this important program. Dr. Wali, we have to talk about America, but we have to talk about America, Dr. Wali, because it's a case study. It's a case study. It's a template for India to also observe. What the Americans did was, after there was a slump in COVID-19 cases, they removed all restrictions. In fact, in the state of California, right after the month of June, there were no masks also, which were mandatory. Do you think that they did too little too soon, and that was something which is responsible for the kind of surge that we are getting to see? And we also perhaps find ourselves in a similar scenario, Dr. Wali, because look at Kerala.
Exactly, you are right, and half of the answer lies in your question. Absolutely. And thank you for inviting me to this show again, and I would say I'm very worried. And this is not only in America, it's also happening, as you very rightly said, in India. Apart from India, now China is also coming up with increased number of cases in at least 4 of its states, which is quite high, and that too with Delta variant, which is fast spreading. And they have identified this came to China from the cleaners of a flight which came from Russia, and they located the date when these cleaners came in that flight. And all that, combining, the COVID cases are on a steep rise around the world. And America is telling us the way we should proceed. And in this observation, one more fine thing read between the lines, I found that this one, Dr. Peter, who gave his findings, he talked about children coming to ICUs. We have been talking about spread in children, and the vaccinated population of children is much more in US than any other country, and we are yet to start it. Imagine in the vaccinated population of children, those who are not vaccinated, about 17% are coming to the pediatric ICUs, which we take lightly. Otherwise, that children would not be reaching to pediatric ICUs if they are cared properly. Then the number, as you said, is huge. 100,000 is a huge number. And for a country who has vaccinated nearly half of its population, those who are missing second vaccines are also included in that count. And Joe Biden a couple of days back was speaking on their national TV and said It is a pandemic of unvaccinated people, which I thought is more applying to my country, because we have greater number of people who are unvaccinated and unprotected, and this Delta variant is probably now getting another dangerous form, which they have said that it is more rapidly spreading than the flu and common cold. So these are the alarms. And new research which they have done on the number of cases is really very alarming, to the extent that they have to give $100 to each person who is coming for vaccination. And the pattern to some extent matches with our country, that America is not one nation, it's the states, United States of America. And why I say this is because they found in their southern states the prevalence of the COVID-19 infection was more, and so was in China, also in certain states, and so, as you told, in Kerala, in India, northeastern states. And this is very alarming, that there are pockets of concentrated patient population, and we have to really get sensitized about this and its infectivity, its tendency to ditch certain tests, and to some extent to the vaccinations, and we have to be very serious about it. That sooner, I would say sooner means immediate, anybody gets a chance to vaccinate, one must go running for getting the vaccinations done. First dose complete, immediately after that slot, whenever second dose is due, please do get it, otherwise it is going to be a big disaster. And in a country like ours, where the population density is quite high, people are moving. And what you said, the point was, they have reconsidered the policy of masking. They have done it too fast. They have done it because it's an open society. And probably we have to also be very careful like them, learn a lesson from them.
Absolutely. They have in fact expedited the disuse of mask very quickly. Dr. Shruti Malik, even Dr. Guleria went on to say just the other day that the R value in India is rising very rapidly. What that means for the layman is that the rate of infectivity, at the rate at which people get infected, is also exponential at this point in time. In your opinion, are we standing at a precipice that we were before the second wave came by, and what do we need to do in order to stop a third wave from doing what the second wave did in the month of April, May and June? Dr. Shruti Malik.
Yeah. So, Vineet, I would like to tell you, we also saw that the second wave, how it came and it actually wreaked the havoc amongst the globally, in all the countries, and globally also it was very, very different, and it took us in a different sort of an orbit, I would say, because this variant was basically a concern for all of us. Even WHO said that this is a variant of concern. Now, my concern here is that because Delta variant, obviously, firstly, its transmissibility was very, very high. Probably it was more lethal. And thirdly, the resistance against monoclonal antibodies and other cocktail regime was very high. Now, what we should do right here is that we need to disseminate globally this information, that the only most precious tool we have right now is the vaccination. Now, firstly, we should, as you asked me, we should be increasing and the speed and the spread of vaccination if we want to evict the virus from our lives. And secondly, we need to reinforce the COVID appropriate behavior if we really want to achieve a proper sort of an ecosystem where we don't want the third wave to come. Now, let me talk about the concerns I have when it comes to India. Now, in India, as you saw in last few days, even a small state like Kerala had 50% of the total cases of the country. Now, my concern for this country is because we have so much of population and our unvaccinated population is very, very high up till now. If I take you through the numbers, total vaccination up till today has been 47 crore, out of which only 10 crore people have been doubly vaccinated, which is very, very less. So here, if the third wave comes, firstly, the health infrastructure is obviously not that strong to take up so many cases. Secondly, the children below the age of 18 years are not vaccinated. Thirdly, the virus is continuously mutating. Fourthly, obviously the herd immunity, the desired herd immunity is yet to be achieved. And today also if we talk, the vaccine speed is very, very insufficient compared to our population. So all these things are very, very major reason of concern for us. As you were talking about the R rate, because the unvaccinated population could be the major carriers. Also, the co-director of Texas in the Vaccination Development Society of Texas also mentioned that most of the people who are unvaccinated or those who have missed their second dose of inoculation can be or could be the major reason of the third wave, as we are already seeing in the US. Plus, if we talk about the children, now the cases which were initially between the age groups of 18 to 45 have now come down to these kids below the age of 18 years in the US. So now you can understand that if the third wave comes to our country, it would be so disastrous for us, for our kids, because they are yet not vaccinated. So we need to make sure that we have to achieve the desired herd immunity, and until and unless we do that, we will not be able to oppose this third wave.
Okay, all right, Dr. Maheshwari, you know, some people who describe this situation as being stuck between the devil and the deep blue sea. But you know, those can't be our only options, because the kind of complexity and the kind of flux that we find ourselves in is absolutely very, very difficult to define. Like Shruti mentioned that only 10 crore people have been vaccinated with the double dose. That's 1/3 of the population of America, but we are a country of 130 crore people. Do you think that it's possible to avoid the third wave with the pace that we have seen for the vaccine? And can just one vaccine which has been given to a number of people serve as a deterrent for the third wave to come by?
See, definitely our best foot forward is the vaccination, no doubt about that, Vinny. But there are other measures as well which we can, right now ride on and help us avert the third wave that we are looking at. See, Corona, for that matter, is one virus where nobody can claim that we have completely degoted the entire thing. And with each passing day, we are learning more and more. So the new learnings that are coming in from US, UK, now the studies say that even the vaccinated people who have got 2 shots of vaccine are as much carriers of the coronavirus as the non-vaccinated people are. So the viral load is equally seen both in vaccinated and unvaccinated people. So definitely COVID appropriate behavior is something that we will have to ride on apart from vaccination. So definitely vaccination has to go on. In parallelly, we have to keep on reinforcing this into people that COVID appropriate behavior has to be followed whether you are vaccinated or not vaccinated. Especially now, since the Delta variant is gaining ground across the world, what we actually need to do is a lot of genomic sequencing, and we really need to do quick surveillance at various stages and at various states as well, where we see the seropositivity rate is very low. Now, especially, if you look at the 4th National Sero Survey, it says some states, right now, which are bottom down in the chart, they don't have good seropositivity rates. So there is a lot of vulnerable and virgin population lying over there, which we need to target right now. So if we could use our rapid antigen test and do fast screening in these areas, then probably we can identify the hotspots much earlier than actually, before the outbreak happens. So one thing is that. Secondly, areas which are surrounding these hotspots need to be on their toes as much as these hotspots are, because this infection then trickles into these surrounding areas. So that is another major area where the government should be very concerned about. Third, they should bring vaccination more to these areas which are still virgin, where natural infection or the vaccine has not reached yet. So that we need to cover this population more, with more aggressiveness than actually these northern states or places where the seropositivity rate right now is much higher than the other states. So probably we need to have a strategy which is more state-driven, district-driven than a pan-Indian policy, and that is what I think right now India should kind of focus on, because these are the areas which would eventually become the third wave focus areas. So we need to plug those before actually, the third wave actually starts gaining momentum. So, and I think that we can still do it if we really ride on our genomic sequencing, if we ride on COVID appropriate behavior, and that is not just for the people, but for the governments as well, because governments a lot of time take decisions which are not pandemic appropriate. Like recently we saw in Kerala that, they opened up everything. So even the governments need to be very vigilant as to which activities they need to open up, which they don't. Now, a lot of schools are getting opened up. I think the government needs to be very vigilant as to which area schools they need to open. Don't make it a pan-state policy that all schools across the state can be opened up. I think they need to open up only where the seropositivity rate is very low, where vaccination of the staff has been done, of the teachers has been done, where the R0 value is very low. So probably it has to be a graded approach, and that is what is required to avoid the third wave.
All right, Dr. Saini, from what has happened in the last year and a half, it's absolutely clear, sir, that this is not a fight between us and the virus. It's a fight between the lifestyle that we had before the virus set in and the virus stopping us from, getting back to that lifestyle. And we seem to be in a rush to get back to that lifestyle. And every time we do so, it's the virus that comes knocking on our door to remind us that, look, I haven't gone anywhere. You need to put that mask on. Have I summed it up correctly?
I think very well said. I will add on to that implementation also. We as population, we know we don't have a lifestyle. We keep on changing our lifestyle. But then the role of a government is also very important. My predecessor speakers also said, the implementation, government has to set the rules of our lifestyle. I have my own lifestyle, you have your own lifestyle. But with this virus, we have to set our lifestyle. So who will be there to set our lifestyle? That will be the government rules. Once the government advises, but that advice should become a rule, and then that rule should be implemented in totality. So that rule is, till the vaccination is not there, or even if the vaccination is there, till at present the situation is, we have seen in US, we find number of cases is over there. So at present, the rule of the government should be, wear your mask wherever the cases are high, and then frequent hand ventilation. Ventilation is also very important. These 4 rules has to be observed. Government should see to it that these are implemented, and there should be monitoring as well. Till this monitoring is not there, even we as our lifestyle, as our parents, we see our children also, if you do not monitor them, sometimes they do not follow the lifestyle which should be there. Similarly, the government has to set the rules that these are the rules, and we are monitoring. Till the time you say you do not monitor it, we know at present you must have seen we do not put the mask properly. So masking, hand washing, and the fourth, I will request whosoever is listening to your program, please propagate that vaccination is important. And from this awareness of mask too, we have to bring a behavior change. That whenever I go, automatically my mask should be on, so that it is come into my behavior. It takes time. Behavior changes take time. No doubt the awareness is there in minds of people. They know that we have to wear masks. They know they have to hand wash. But the behavior change is still not there. Behavior change means it will automatically come to you that yet I have to do those things. That is, till the time this comes, you, me, each one of us who is actively involved in this has to keep on doing this. Thank you so much.
Dr. Wali, it's very right, Dr. Saini, what you said. And, it does beg one to, in fact, think and ruminate that the government has to do, it has to come up with, some sort of a rule, some sort of, a pressing concept on people to wear masks. But at the end of it, Dr. Wali, it's upon us to follow them or not. The government can only advise, propagate, and promote as much. But at the end of the day, it's incumbent upon us to value our life and the vulnerability that is associated with COVID-19. Would you concur?
Absolutely, but I was thinking right now when Dr. was speaking that we have to care for lives. When there will be no life, there will be no style left. As simple as that.
Right.
So we have to be serious about it. We have to remain alive. Nobody wants to die. We have lost so many people. Go back and think about it. How many graves they are showing in a country like Indonesia? They are digging every day. What is happening in the world? Think about that. Just think about that. That you won't dare to go out. The people are going out. 50% people I can say are going out without any reason. Rest 50% for them is a must to go out to earn their bread and butter and livelihood day to day. There are some people who earn every day and spend every day. जिसको हम कहते हैं रोज कुआं खोदते हैं, रोज पानी निकालते हैं. There is a great number of population in country like mine. So we have to be serious about it. Yes, masking, very important. In America, they have said you do remask yourself. You do go back to the masking, and that's what they have changed. That's what they can change, and that's what we can adapt. So all this summing up in your today's program, I would say if somebody would watch this program after a month, he would realize that all your speakers, learned speakers, how correct they were, when the cases will be surging, and this surge I can say would be very fatal, very dangerous, and very worse, would be very worse, because we are getting indications that children are being involved in a country like America, where children are not much. Here, in every house there are 4 or 5 children. So look at the proportion of the child population in our country and
Correct.
country like Europe and America, where on one baby is walking on the road sometimes. And if you go out with children, there will be 3 babies at least in one pram going out. So this is the ratio. What I am giving this example to.